Welcome to CoI'Q, a first-of-its-kind video program about health innovators, early adopters, and influencers, and their stories about riding the roller coaster of healthcare innovation. I'm your host, Dr. Roxie, founder of Legacy DNA Marketing Group, and it's time to raise our CoI'Q. Welcome. On today's show, we're going to examine the three most important unspoken languages in healthcare innovation. Dr. Paul Markham, who's been successfully launching and commercializing new product innovations in healthcare for nearly 2 decades, is joining us today. He's going to reveal the unwritten rules of healthcare and decipher 3 unspoken languages: data, doctors, and dollars. Welcome, Paul.
Thank you very much for inviting me, and I'm excited to talk to everybody.
Thank you. So before we get started, just in case everyone is not familiar with who you are, I'd like for you to share a little bit about your background and what you do.
Sure. So who am I? Well, that's a good question, right? Apart from the paperwork, who I really am is somebody who was going to be a rock and roll star in the 70s. I was going to be that guy. We played backup band for the AC/DC. Then I went on to be an R&D electronics engineer. But along the way, I found out that I had a really strange personality, something called a blink. If anyone wants to look this up, Gladwell talked about it. Us guys and girls are actually thin slices. So we see the end point before others. It's not an IQ thing. It's just a very different perspective on life. I then went on from my Australian heritage, came over to the United States with a large company called General Electric. We were involved in all 28 acquisitions, and we were going to build, the new future of personalized, proactive healthcare. I was an absolute sucker for the story because I actually believed in it. Along the way, I decided to write a doctorate related to iatrogenic death, not because I'm an academic per se, but because I've got a passion for doing something about the 3rd biggest killer in America. Anyway, from there, I've been involved in all sorts of things. Raising capital, acquired a company involved in some pretty cool stuff, organ transplant, bone marrow stem cell. I'm an advocate for anything that's futuristic. I'm very closely involved with Singularity University. I'm forever involved in anything that looks like it's going to impact on that very important, that unreported statistic, guys, which is iatrogenic death. Unfortunately, it's not something that gets a lot of publicity. We hear about cardiology and cancer, but not number 3 too much. And frankly, more recently, I have become an academic because I really want to get to people. I was just talking to Dr. Roxie before this started. I want people to understand they need to know why they get up in the morning. I get up in the morning because I want to learn stuff. I never realized that until I got a lot older. The second thing is I want people to understand their uniqueness. Because as we move forward here, you've got to be somewhat unique, not just from 360 million Americans, but from 6 billion around the world. But frankly, I'm passionate about anything like what we're doing here today. If it makes people just pick up one golden nugget that they can take with themselves moving forward. Thank you.
That's exactly why we're here. And what a creative, diverse background. We'll have to talk more about this AC/DC band in the future. Very interesting. So you mentioned that you have a doctorate in business administration. How do you think that that's, shaped the insights and guidance that you give to the clients and the healthcare companies that you're working with in a unique way?
So it's an interesting one, Dr. Roxie, that the doctorate really for me was a mindset, meaning getting myself into a situation where I clearly have to justify and be more objective about everything. But what it does for me, I talk about the fact is I can barely speak English with this Australian accent. But frankly, people tell me, Paul, you speak 3 languages: data, dollars, and doctors. Mm-hmm. Now, I'll give you a real world scenario. I was in a Midwest hospital yesterday, wonderful place. But I found that I had to be chameleonic, frankly, when I spoke to the finance people. Chameleonic meaning had to change the whole discussion when the nurses and doctors walked in the door. Then I had to have a different discussion with the business intelligence folks. Mm-hmm. If I was to say there's one challenge in the United States, which I love, by the way, and I have citizenship here. So what I think is the challenge of the United States is the specialization. Okay, so where I come from, unfortunately, out in the Antipodes, we have to actually understand the horizontal landscape. That's how I ended up in this country. You have to understand, frankly, data, dollars, and doctors, because you don't have another 15 people around you to do anything. However, in the world moving forward, it's kind of an interesting political statement, is that you've got to almost socialize healthcare, even if it's capitalistic. We've got to figure out a way to get everybody to talk together and to understand those three languages. And I believe, back to the original question, the fact that I had to defend a dissertation and I really got inside the minds of physicians, right? MDs, for instance, if you want to get a physician sponsor, my doctorate was related to adoption of CPOE and EMR. It's a long time ago now. What I learned about physicians, right? Transformational leadership works, but it works in a different way. If I'm in the corporate world and I bring in Mr. Richard Branson or others, it's going to work. Even Lee Kuan Yew in Singapore, that kind of idea of that charismatic, that leader. What I learned from my doctorate, Dr. Roxie, was the fact is that it's not that. That's not how it works in healthcare. The best physician sponsors that I met were people that were self-deprecating. If anyone remembers that old TV series called Columbo, it's those people in the room that seem like they have no idea what's happening, but they're able to get followership, it's called. It's a different form of leadership. So the point of the fact is, I think from the doctorate, what I learned was to get the insights of not only the medical fraternity, but I got to know chief information officers very, very well, right? And the thing is with the CIOs, it's sort of like so logical, but if you don't ask them, you don't know this. If you don't interview them, and if you don't interview them with mixed method analysis, meaning survey, qualitative, and basically bringing it all together, I found out from CIOs, we all think they're about the data. They're about the money. It's not because that's a bad thing. It's because most of them report the CFO. So we're here like, wow, I wonder why they're not talking to me about, how this wonderful interoperability. And it really comes down to, you've got to absolutely understand the language of the buyer. And just to sort of, if you don't mind, I'd like to load onto that something very interesting. Here we are in healthcare. Right now I'm involved in a bunch of things, a couple of really cool artificial intelligence companies and blockchain, all the rest of it. Here's what we know about healthcare. We think about, let's put our researcher hat on for a minute. Here's what we know about healthcare. Nothing happens in healthcare quickly. The second thing we know about healthcare, when it does happen, it happens because people are forced to do it. This is an unpleasant thing probably for people to listen to, but if we really cared about the clinical outcomes, well, we wouldn't be burying 250,000 people a year. If we really cared about the physician, environment and the clinical environment, well, then we wouldn't be allowing them to have episodic EMRs and basically a million different systems that don't connect. We wouldn't allow that. So what we've got to do, we've got to understand those three languages. We really need to understand how to get the messages to different people, because if there is no financial benefit, when I say that, I'm going to be really clear on what I mean. If there's no financial benefit, or there's no reason, meaning the bundle payments are changing, or CMS is coming down, or meaningful use is coming in, if there's nothing like that, a forcing mechanism, it's never going to happen. So what I've found is we've got to start thinking like the rest of the world we live in. We all live with Airbnb, we all live with Twitter, we live with Uber, and yet we come to healthcare and we go, well, you know what we're going to do? We're going to keep selling these applications. Not going to work, right? We've got to start thinking about software like an ultrasound machine. People have got to see these things as revenue generators, as horrible as that may sound, because then what's going to happen? Think about turning the pyramid upside down. If we can get these to be revenue generators and something that's actually really going to change the business of healthcare, then we're going to have incredible clinical outcomes. We're going to have quality metrics through the roof. But I think all too often we get a lot of new sort of CEOs of these small companies. They're either MDs or they're basically very smart technical people, and then they say, here, look what I've got. And what us marketing people know is it's coincidence and needs, right? We've got to actually look at the market and find out what is going to actually, how are we going to get this thing into the market? So that's just sort of I guess a long answer to your question.
Mm-hmm. So you talked about data, doctors, and dollars. So
Sure.
yeah, so let's dive into that just a little bit more. Give us like a real world example of how you would speak to all three of those languages in a specific scenario. So if I'm a healthcare innovator and I am approaching a health system or a hospital system with my innovation, how am I approaching it and being able to speak those three languages?
So you've got to understand and it's really this simple, the language of the buyer. So
Mm-hmm.
imagine this, for instance, and basically I'll talk about what we did yesterday because it
Okay.
was literally yesterday. So when I sat with the administrators of the hospital, I did my research, I did my homework. That's the other thing, people don't do this. So back to the doctorate education, it sure helps with this. So before I walked in there, I understand where this hospital, actually, let's talk about the dollars for a minute. I understood where this hospital was on margin.
Mm-hmm.
Seriously, the hospital was around about 2% operating margin. You got to understand this stuff. And
Mm-hmm.
the point was, when I talked to this hospital, I talked to them in pure financial terms. I talked to them about some of the CMS bundle payments that are coming in. I talked to them about basically how this particular thing that we're talking about, this artificial intelligence application, never use those words. Oh,
Mm-hmm.
no. Never use the words they understand. This is a revenue generator. This is a situation that is actually going to change your operating margin. Now, this all
Mm-hmm.
sounds like, wait on, Paul, are you selling a clinical application? Oh, absolutely. But here's what happens with most companies. They don't do that story. They pitch to the doctors. The doctors say, oh, that's wonderful, Dr. Roxie. I want one. But then it hits the finance person's desk, CFO, like we were talking to yesterday. If they
Mm-hmm.
don't buy into it, it's never going to happen. So what
Right.
happened from yesterday, we actually found out that this particular institution, here's what people tell us, and then we don't listen to them. They said, you know what, Paul, the best thing about what you've told me is the concept that you're involved in or you're interested in coming into a partnership with our organization, meaning we are interested in a revenue share. Now, you might say, well, that's interesting. Is that a big deal? There's a company called Athena that will actually tell you that's a big deal. Back in the old days, the CEO of that company was basically, I think, unnecessarily jeered at by the industry, saying, you're going to start an EMR company, good luck with that. But what he did, he spoke dollars. He went and actually talked
Mm-hmm.
to people and said, here's the software. We'll just share in the profits, so to speak. And my point to you is basically that story that I gave these people yesterday, the financial story, I'm still talking about clinical software, okay?
Right.
But the
Yep.
story was, if I had gone into these CFOs and said, oh my God, we've got this artificial intelligence platform, it's going to make the doctor's lives so much better. They're going to go, oh, next, right?
Right.
So that was number one. Number two, the difference with doctors, and this is straight from the doctoral background, what I did was I talked to MDs, and if there's MDs on here, please take this the right way. We have set MDs up for failure, society. We've got them at the top of this food chain. We've said they're the top 2% of society. Now, unfortunately, they are then put into a really thing, and they're just not. They can't be. They're humans. So what I did with these people yesterday, the docs at least, I actually asked them to educate me on what I was selling to them. It's a very
That's a
different
big
concept.
difference.
It's a really big
Mm-hmm.
difference, right?
Mm-hmm.
In other words, before we even got out of this place, these people were sort of telling me how the product should be developed. And frankly, I'm okay with that because I let them understand. For instance, I don't talk to them about artificial intelligence. I came up with an acronym that is directly related to something that these people know about, and they got it in an instant. Now, then we met with the IT people, and normally the IT people, anyone on the line will know this, they're sitting like this, looking back like, you're a bunch of salespeople in here, we're not going to listen to you. So then what we did, we empathized. The first thing that I found with a lot of these people, a CIO has a shelf life of what, 12 to 18 months? These are
Mm-hmm.
tough jobs, right?
Yep.
Most of them are looking at Epic or Cerner implementations that are going to get them fired because they don't know the tail end of this thing. So the first thing I said to these guys, I said, I want to understand your architecture. Again, it's sort of taking the time. And the
Mm-hmm.
minute you use their words, architecture, that's interesting. Oh, so you've got actually this particular topology, you've got to not just know the jargon, but go deep enough to survive, right? Because then these guys come back and they ask me questions. What it is, it's like, let's see if this guy knows his stuff, right? Now, I'm an electronics engineer, but I'm not someone that can go deep enough to cut code anymore. But I do know enough to understand what their situation was. And again, really, it comes back to research. Before I went to this institution, I knew this place was an IBM backend. I knew this place had a particular EMR. I knew what they were struggling with. I knew what their pain points were. You're probably thinking, boy, this is simple. But think about it. This is on 3 different levels. People don't do homework enough. In other words, it became about them, Dr. Roxie, not about me. It wasn't about us. And you know the beauty of the whole thing? Before the end of our discussion there, we were all sitting on the same side of the table, and one person from both sides, meaning us, the vendor, and them, the organization, 2 of them were up on the whiteboard. I don't know, that sounds like a really good situation to me. And we still had the 3 groups in there, data, dollars, and doctors. This doesn't happen much. And I think that that's one of the things that I feel pretty excited about. Have I solved healthcare yet? No, because frankly, and you and I have talked about this, we're not even doing healthcare yet. We're doing sick care.
Right.
When we actually do go to a genetics technician before we even enter healthcare and we start doing actual proactive, then I'm going to say I'm in healthcare. But I feel committed to doing something with what we've got out there right now.
So thank you so much for that. I want to kind of dive deep into this. So, you and I have talked previously about the research statistics and the number of health innovators that launch a new innovation into the market, especially in healthcare, and fail. They fail to reach any level of customer acceptance or profitability. So from your perspective, why do you think some healthcare innovators succeed and some fail?
Yeah, and you see, words are important. So if I said to you it's all about marketing, what most people say is, oh, it's all about promotional. Absolutely not. So I'm going to use a definition. It's all about product marketing. So what do I mean by that? If we think back to Steve Jobs, okay, what he did, he actually got an iPad and sat with people and said, hey, if you swipe this thing to the right, is that what you want to do? Great. So the people that succeed are the people that actually do a lot of research and absolutely pointless trying to sell anything to healthcare. It's something that you've got to find that unmet demand. And not only that, you've got to actually park your ego at the door. And I've done this before as a consultant. I'll tell people, I'll mail them a card before we have the meeting. You've got to park your ego at the door. So many founders have probably got IQs of about 200, but what they don't understand, they've got to learn to listen, right? In other words, just because you've just invented the greatest widget alive, it doesn't mean a darn thing. And I'll give you a scenario. One of my dear friends set up a meeting in New Jersey some time ago, and we sat with some super power broker CIOs from the Northeast. These are people managing $5 to $7 billion organizations, and basically part of product marketing research. And if these other companies did this, they would learn that they're going down the wrong track. I just went to RSNA. There's all these startups there. I would say 99% of them are going to fail. 1 or 2 of them, maybe not. So anyway, what we did at this meeting, we did some really interesting things. We said, hey, CIOs, we've got this great new thing. It's going to save so many lives. It's going to cut costs. It's going to do all this stuff. And they said, wait, do you want to hear from us and what we do in our lives? And we go, yeah, that'd be great. So what they came back with was very interesting. They were actually hugging each other, frankly and honestly, because they were actually being applauded in their organizations. Why? Because they had 600 clinical applications. They got them down to 75. Now think about the implications of this. Here out in the market, you've got all these new healthcare innovators saying, oh my God, look at this new thing. It's going to be great. We're going to bring it into your organization. And the people that are actually going to block you are saying, thanks, but we're actually getting rid of 150 applications or 200. And our CEOs are saying, thank you for that, because then we're getting rid of the cost, the service costs, and all the rest of it. So again, it's understanding what the market is. The idea of a good idea, come on. I mean, look, seriously, if things were a good idea, us marketing types know this. For instance, beta cord versus VHS. This is a great example. Beta cord back in the day was a much higher quality, but they picked the wrong channel. Shock horror, I'll tell you another one. Apple. I teach this stuff and people go, well, Apple's invincible. Well, not anymore. But in the early days, what Steve Jobs did, he totally thought marketing or product marketing was a big joke when he first started. So he said, I'm going to pick education. Now, Bill Gates got lucky. He picked business. The problem is that comes back to healthcare. You've got to really understand what you're looking at. Don't assume anything and park your ego at the door. If you go into an organization and they go, nah, well, you better listen to that. You better start looking at things like CMS, what laws are changing. For instance, real world example, there's a thing called an ECMO. It's like a heart, best way to say it, it's like a heart pump for people that are waiting to go on to transplant. Now, last year, this had a reimbursement of $104,000. That sounds pretty good. This year, that could go down to $7,500. Ooh, what?
Wow.
That might be an opportunity for artificial intelligence. Not because of artificial intelligence. Remember, the big problem out there is not selling the feature, but understanding what is the benefit and does anyone care? I mean, who cares? If I come up with this little technology, I saw some great things, again, at trade shows, and I see them and I honestly look at them and I think, they're going to get the $2 million maybe. I'll have the 6, what I call pilot syndromes, where they basically cajole and get some of these big medical centers to run their software for a bit. But it's whether they can move over across the chasm into mainstream alley. That's the big deal. So that's my answer to your question.
Excellent. Thank you so much. So much rich information in that. So we talked before about the unwritten rules of healthcare, and you touched on them a little bit, but if you had to identify them specifically, what do you think some of the unwritten rules are that you're encountering in day to day?
Yeah, I think because I'm this old man of the sea, some of the stuff I'm talking about is not anecdotal. I guess what I talk about is factual. It's after being involved in many slam doors and incredible amounts of wasted money on trying to basically tell people that this is a great idea. Here's the unwritten laws as far as I'm concerned in healthcare in the United States, but similarly around the world for different reasons. If there's no forcing factor, it's not going to happen. I mean, the people, I don't want to use names, but let's just say the people that own the EMR companies did very, very well, but in a funny way, they got lucky. The traditional EMR companies got lucky with meaningful use, the $44,000, etc. Yep. I look at that and I think, has anyone ever thought what the actual forcing factor, if that forcing factor wasn't there, would these episodic revenue cycle sort of centric, meaning the wrong model, and they know they built the wrong model, they absolutely do, would they even be in existence? Would certain individuals be worth $3.9 billion? No, they wouldn't. So one of the unwritten laws is, as far as I'm concerned, based on fact, if there's no forcing factor, it's basically a pointless situation that you're involved in. Good luck. People are going to look at it. Dr. Roxie, they're going to say, oh my gosh, you're so strategic, and I love the accent, and thanks for the koala. And then they'll go like that, and you'll be on your way. Let's look at the next unwritten rule, that if you're going to try and market or sell something in healthcare, if there is no budget, they don't just invent money, right? It's just, there's no additional, maybe some large medical centers have things like benevolence funds. Some information departments have things like an integration fund. But the reality is, if you're going to try and sell something, it's going to change everything. And then you find out there's no money for it. Well, you've got to actually think harder. You've got to think like that guy with the EMR company that people sort of said, it's never going to work. What he did, he listened to the market. So the market says, I have no money. Maybe what I'll do there, I'll set up like a revenue share on the back end. That was a very, very smart thing. That meant that he was listening to the market. So basically, if there's no forcing mechanism, I mean, honestly, good luck with it. The idea of getting stuff that's make the doctors' lives easier. I heard a really interesting story from a friend of mine, And he said, I was standing in a large medical center and we just finished a presentation where we said, and we are going to save you $17 million. And honestly, you would have thought it was the Academy Awards. We would have, everybody would have received an Oscar, and essentially everybody was yawning. So the reality is, don't assume anything. So you know, if you're in an organization and you say things like, oh, and it'll replace all these FTEs, that's great, but that's not how hospitals work. Again, understand the buyer. Might be that it's never going to get into a situation like that. The third thing about it is, as far as I'm concerned, think harder. Here's an unwritten rule. Be smarter than the other guys. And I'll give you an idea of what that is. You might have a platform that is really good for clinical assist. No one's going to buy it, right? The doctors are going to jump up and down. But unfortunately, the good old days of the doctors, MDs, knocking on the CEO's door, say 20 years ago, we'd go and talk to the doctors and they'd go and force the CEO to buy something. Excuse me, that's not there anymore. It's gone. However, imagine if we're able to basically dig deeper and think harder and reposition it. So here's an example of that. Just say we've got a platform that's going to make the world easier for doctors. Is that going to sell? Is that going to market? Well, somebody might tell me they've done it and happy to you. For the most part, people are going to yawn again. But how about if we go and see the chief counsel of the hospital? This is something I've been involved in. We start positioning this as a risk mitigation platform. Wow, what are you talking about? Well, we start looking at the MDs in the world and we find out that neurosurgeons are the #1 sued doctor, followed by cardiac surgeons. And then you start thinking malpractice suits. Now, the good old days, it didn't matter to the organization. But these days, many doctors, I think it's 52% now, work for the hospital. So all of a sudden, you may be able to, through thinking harder and talking to different people in the organization, if you start talking to a chief counsel or a chief quality officer, I kind of call it this Venn diagram of clinical, fiscal, and quality. I'm not going down the triple aim thing. Again, that's another marketing pitch. But the point is, the third rule is you've got to think harder. You cannot assume that whatever you've got, in my humble opinion, and factually, that anyone's going to listen to it. Everybody out there is going to take the meeting. They're going to do the pitch. But you've got to also understand what is the motive of them taking the meeting. You've got to actually think to yourself, is this actually an end goal? So for me, some of the unwritten rules in this country at least are essentially understand, is there a forcing factor? Secondly, is there actually a way, is there actually a financial way to get this done? And thirdly, are you really talking about the benefit of your product? Meaning, hey, we can actually cut down on malpractice suits. That has a different ring to it than, oh, we got an interoperability engine it's gonna be great. You know, the ducks are gonna love it, right? All this type of stuff. It sounds like the right idea, but we might have to go outside and chameleonically go to a different department and have a very different impact. So that's my take on it.
I think you touched on a bunch of different things that like positioning strategies, messaging strategies, product market fit, really, focusing on the buyer's needs and solving their real problems instead of about your widget and how awesome it is. These things are just fundamental to marketing, no matter what industry you're in, and there's so many additional complexities to commercializing and innovation in healthcare. Let's talk. You touched on pilots a little bit, and I think that's one of those additional complexities to healthcare. It's a real challenge. I hear health innovators talking about this all the time. They've got this innovation. They get really excited when they get this pilot opportunity. But many innovators get stuck in what I call pilot purgatory, right? They just never come out of this pilot phase. Describe for us your experience with that phenomenon, and how can health innovators avoid that, getting stuck in pilot purgatory?
So, and this is just coming from real world experience. So many years ago, I got a phone call and somebody said, hey, can you come in and look at this company and tell us whether we should keep it or shut it down? It sounded like an interesting thing to do at the time. Now, most little companies, I'm not going to name the organizations, but everybody knows what little companies think is the right thing to do is to find the big brands out there, insert name, right? Da-da-da medical center, da-da-da medical center. And it seems like a great idea because then you put it on your website, you know, you've got these 6 accounts. It's wonderful. Look, frankly, guys, they're never going to pay you. It doesn't work like that. And I'm not saying they should pay you. They've got this, they've built up brand equity in these massive medical centers. And frankly, it is a good idea to work with those organizations. They're wonderful to work for. But over here, you've got a thing called a business with cash flow, etc. So anyway, this organization I got involved in, they had all that, right? It was a Midwest company. They were flying around the country to all those medical centers, burning cash, enormous amounts. No sales, not anywhere likely, because frankly, it's kind of a privilege to be in some of these medical centers. I mean that quite honestly.
Sure.
Kind of is. But most people, like this organization, I said, how about we hunt closer to home, right? Ooh, what? So we literally, and this is a true story, we physically walked across the road from where this little office
oh my goodness.
to a medical center. I'm not making this stuff up. And we walked in and said, hey, we're doing ABC. What do you think? So after we got through the whole, you know, discussion about the local football team and all this type of stuff, we started. But what I did with those guys, I know the pilot syndrome. Honestly, I was just out at JP Morgan, and when you talk to some of these guys, everybody knows the game, right? So you've got to do everything in your power, and I'm not saying it's easy, but you've got to do everything in your power that if you do a pilot, if you really have to do that, because unfortunately healthcare has been idiotically set up into this thing where everything's free. It's just not free. You've got to really write contracts. I like to do a non-disclosure agreement around a contract that will then actually move into something. And what I say to the people in there, and I never just talk to CIO, I talk to data dollars doctors. I'll actually talk to these people and say, look, we really want to do this, but we're a business, and for our success is, you know, your success, you can't run a business on nothing. And I'd say that's the number one thing I hear at these trade shows, and people go, oh, we're in at, and they go A, B, C, D, E. And of course, those organizations love to see new tech. Some of them might get through, right? But sometimes, how do I say this in a nice way? Go to the boring places that are actually doing healthcare that don't have, you know, let's just pick some, I don't want to pick cities because I don't want to upset anyone, but maybe you go to a particular place in Georgia, you might go to a different place in North Carolina, you might go to Nevada rather than California. I mean, I love all these places, but
sure.
If you're a young company, is what I say to people, just you're here, right? If you're in New York City, why are you flying out to Intermountain Health again? You know, if you're a company that's set up in Houston, Texas, and yet you're trying to go after Mayo Clinic, what?
Right.
You know, so hunt locally and be really smart about it, and just understand somebody saying to you that they love your technology and all the rest of it, it doesn't necessarily mean that it's going to pay the next check. So anyway, with that company, we then hunted locally. We got to know the CIOs literally across the road. He then told us where the next CIO was. We then set up a CIO dinner at HIMSS. This is a long time ago in New Orleans, where they all came along, and the absolute justification for the dinner was this. We're talking about artwork and golf, meaning no pitching, right? And it sounds like simple. And we went to this dinner and we got to know these people, and we built rapport and relationships. The people happened to come from all of the 5 sectors of the United States, so it was kind of helpful. But the point was, then we diffused out from there, and we never had one nickel of free pilot. And I'm not saying it was easy. It was tough. Because everyone says, oh, well, listen, why don't you do a pilot? We always say, look, and we bring the statistics up. I mean, pilots don't work. They don't. They kind of look good for, say, a clinical research paper or something like that. But if you can get into a situation, look, it's like, come on, we're in the world, right? Anything you get for free is worth exactly what you get. If there's no exchange between you and the partner, it really means that it's not a real relationship. And I know that very, very well.
Yeah.
So anyway, hopefully I've answered your question.
Absolutely. That's fantastic feedback. So the last question that I have before we open it up to Q&A is, we've got several health innovators that are in the trenches right now. So what advice do you have for them?
So if I was to give you one piece of advice, learn finances. If you don't know them, learn them really well. Start to understand. This sounds like, what is he talking about? But seriously, understand you're running a business. You might be passionate about what you've got. You might be in the clinical sense or the technical sense, or whatever. But be a leader in a way that you understand when it's time to step aside. I saw some different leaders along the way. One of my favorite companies is Life is Good. Why? Because they make a t-shirt that is actually high quality. And frankly, I love t-shirts. This that I'm doing right now, this is all part of personal branding, right? No, but seriously. So
Yep.
the point of it is, I would say to innovators, don't assume anything, question things, think harder, but think beyond, okay? So I think when I hear a lot of this stuff about artificial intelligence, I hear about blockchain, don't just listen to that, do your research, right? So if you think about blockchain, blockchain in itself is just a story that normally is followed by, oh, you mean Bitcoin? So people are completely missing the point. Blockchain in itself will change the world. There's a statement. There's no doubt about it. The technology right now is too early. But let's think about healthcare for a minute. If I'm an innovator and I'm not thinking about other technologies, that's my point. Think harder, do more research. Don't assume your business is going to be there for another 5 minutes, let alone 5 years. You've got to be absolutely thinking ahead. You don't want to be Sears or Boston Store where you're sitting there after it's all happened going, oh, what happened? Like, whoa, where did Amazon come from? Likewise with Amazon, should be looking at Jack Ma in Alibaba and saying, oof, hang on, they're buying stuff in Alibaba and selling it at Amazon. My advice back to innovators is, you're not nearly as smart as you think you are. You might have an IQ of 200, but IQ is not what's going to win this battle. It's really doing deep research back to blockchain. So when I first looked at that, I thought, hey, I'm a technical guy, so I thought, oh, it looks interesting. It's a good story. And then I thought, wait on, there's 3 things that blockchain could do for healthcare. Gee, I don't know, unique identifier, man, that's interesting. Smart contract for all adjudication, immutable database. That's not a bad start, but that's not really the point. Let's think harder on that for a minute, Dr. Roxie. Let's think real hard on that. In healthcare today, there is no patient-centric approach. There just isn't. If I go to don't want to use the name, but an EMR, insert name, this is an episode of care. I'm a doctor. I need to look at the longitudinal view, but it hasn't been built that way. It's a wrong model. It's been built around the revenue cycle. So here's the thing people miss in blockchain. Apart from the fact it's going to be, here's the producer, here's the user that's going to take everything out of the middle, meaning all of the layers of healthcare insurance, blah, blah, blah. But here's the more important thing. What they miss on blockchain is they get hung up on the token. Blockchain is like a racetrack of the future. It's like the internet turned into a database. But right now, what people don't talk about is, if I have a blockchain wallet, right, all of a sudden my wallet is, right now, it's for a token. It's like for a financial thing. There's no reason that can't be a patient-centric electronic medical record, patient-centric identification of everything for genomics. There we go. We might do some healthcare sometime. The point is, if I'm an innovator and I feel like I'm just about to get over there, that's number 1. Number 2 for the innovators, stop trying to sell direct, guys. It's just too hard.
Yeah.
Go to the big med centers. Why don't you say to yourself, hey, maybe there's a company out there that I can make smarter, meaning that there's a company in the device market. There could be a company in the pharma world. There could be, do you know, if there's one thing that's going to make you successful, here's a clear real world example. I was involved with a company and I said, hey, we need to OEM our software, shrink wrap it, and put it in this other company's portfolio. Now, we're only going to get $7,500 every time someone touches it. I'm not going to go into what it was. It doesn't matter. And
Mm-hmm.
I fought with the board of directors on this. They said, you're underselling the product. It's $1 million platform, blah, blah, blah. I said, okay, fine. So not long after that, we were getting $350,000 cash per month, right? And it kept the company afloat. So
Mm-hmm.
stupid in that. Point
Mm-hmm.
is, people think that they're able to, in the United States of America, what have we got? I think 5,800 hospitals. Start to understand how people buy stuff. Start to understand, I've done a lot of work in supply chain where people will come to me with this new little thing and say, oh, it's going to change, this new Q-tip. It's going to be great, because I do a lot of stuff with people in China. The reality is, think harder, look at beyond, the direct channel. That'd be the second thing I'd say to innovators. And I'd also say this: question and then question again. And when you finish questioning, it's a little bit like when you do your doctorate, right? Proofread it, and proofread it again. Because guess what? It changes from day to day, okay?
Absolutely.
It's like I'm in the back of that Uber in San Francisco, and I said to this guy, what are you guys thinking about with blockchain? And when I told him about the idea that the hidden message behind blockchain is that it's going to take out the middleman. And he goes, wait on, are you kidding? That means it takes out Uber. And I said, oh, absolutely. And he's like, what? That can't be right. So that's what I'd say to healthcare innovators. I'm not saying take the easy road, but if you find out there's a device vendor or a pharma or biotech or something that's got a gap, and you can sell a little baby piece of whatever you're doing 1,000 times, you're going to be in business. And then you can go and you might be able to afford to do your pilot syndrome if you really have to do that. But you might find, wait a minute, all of a sudden I don't need to be paying 150 grand a year to a sales rep. And by the way, I'm a sales guy, so I'm not against salespeople, but I'm just saying a business-to-business model is a really smart way to go for a small company. And often small companies for me miss two things: product, the first P of marketing, meaning they're building something, then trying to sell it.
Yep.
The last one is channels. They do all their work on basically trying to just stay alive. Their website's awesome. Oh boy, they've got a great website. You got to have a good website, no doubt. But I'd say I'd spend more time on getting the message that someone understands. Don't assume anyone understands. While we're actually using neural networks, machine learning, deep learning, we're actually going to go to reasoning computing. And what do you think? And the people on the other end, especially if they're MDs, are going to go, yeah, that's interesting. And they're probably thinking to themselves, I wonder where I'm going for dinner tonight. I mean,
Right,
they've got
right.
no idea what you're talking about. So if you say to them, hey, what we're doing is going to take 15 minutes off that stupid report you do at the end of the day, they'll say, what? What?
Yeah.
That's what I would say.
So thank you so much for sharing. What's the best way for people to connect with you?
I've got about 11,000 data points. I've got, it doesn't matter, text message, LinkedIn, WhatsApp.
Okay.
Come on, Dr. Roxie, you know this. I mean, I'm connected, and I'm happy to talk to people anytime. I'm not the oracle, but I might just make you do one thing: is think harder. Just do that for me. Just think harder before you do anything. Question yourself. I mean, honestly, I do it all the time. I even question what I'm talking to you about, because I go back and I want to test it. I want to see, does this make sense? And here's the thing, I'm always talking to the customer.
Yeah.
We talked to all these different people, data, dollars, doctors. I asked them, I said, look, before we start this discussion, what's going on in your life, right? We found out what they cared about. Frankly, we then sculpted how we were talking to them. It didn't change that much. It did a little bit. There was some stuff there that I didn't understand. Like, here's a classic, and we'll just close out on this. We're talking about artificial intelligence in healthcare. So first thing is stop using that word, because it's only relevant to a bunch of IT people, and everybody else it's like, ooh, it's crazy, it's going to take my job and all the rest of it. It's just not right, talking to the wrong people. But I said to this guy, I understand your workflow, but I'd like to understand a little bit more. And here's exactly what he said. He said, you know what, Paul, no one ever asks us this, but here's what I'll tell you happens. He said, I'm in an ICU, and without doubt, everything goes wrong when I'm not there. Think about how powerful that statement is. If you really listen to it, artificial intelligence can instantly help that. but no one's ever asked him that before. So essentially everybody's trying to fix the problem while all the people are there. And he said, if I could just pick up a little alert on my phone saying, hey, bed 6 needs to come off a ventilator, he said, oh my God, it'd be great. But it never happens like that. I get in the next day and I've got a whole bunch of stuff I've got to deal with. So thank you.
Absolutely. Great closing words for us.
Thank you.
What's the difference between launching and commercializing a healthcare innovation? Many people will launch a new product. Few will commercialize it. To learn the difference between launch and commercialization, and to watch past episodes of the show, head to our video show page at drroxie.com. Thanks so much for watching and listening to the show. You can subscribe to the latest episodes on your favorite podcast app, like Apple Podcasts and Spotify, or subscribe to the video episodes on our YouTube channel. No matter the platform, just search CoI'Q with Dr. Roxie. Until next time, let's raise our CoI'Q.